We continue with interviewing techniques. This time we discuss stools. Inquiry about the stool includes the stool's regularity, consistency, and smell, and whether there is pain associated with passing of the stool. Something that ought to be fairly straightforward and easy to get concrete answers about can sometimes be surprisingly difficult because many people are not very conscious about their stools and can only provide vague answers. It is also important to define for a patient what regular bowel movements are. Once a week is technically regular and so is 6 times a day, but both cases are signs of severe imbalances. Once to twice a day is considered normal, and less or more often than that is an expression of an imbalance. The consistency of the stools can deviate from normal by being watery, sticky, or dry. Constipation is when stool movements are less frequent than once daily. Knowing that a person is constipated is not enough. It is also important to ascertain the consistency of the stool and whether there is pain associated with passing the stool. Acute constipation can be due to an invasion of exogenous pathogenic qi. This will either be a direct invasion of cold in the intestines or excess heat from an invasion of exogenous pathogenic qi penetrating down to the yang ming aspect. If the invading pathogenic qi is hot, the stools will dry out and the abdomen will feel tense. If the invading pathogenic qi is cold, the stools will not be dry. There will be cramping pain and the abdomen will feel cold on palpation. Apart from excess heat, yin deficiency and blood deficiency can cause the stools to be dry due to a lack of fluids. The difference between deficiency and excess conditions can be determined by whether there is pain or bloating, which will occur in an excess condition. Liver qi stagnation can also result in the stool not moving freely and smoothly through the intestines. Therefore, the stools will typically be pebble-like, similar to goat droppings. If qi stagnation has generated heat, the stools will also be dry. Qi stagnation can cause the movement of the stool to be sluggish, taking a long time to pass through the intestines. There may well also be pain, tension, and bloating in the abdomen when there is qi stagnation. This will be alleviated by the passing of the stool. It is important to remember that the stagnation of qi in the intestines is not always due to liver qi stagnation. Liver qi stagnation can also manifest with alternating constipation and normal or loose stools. Spleen qi deficiency can be indicated by stools that are long and thin, like a pencil. The stools will have an otherwise normal consistency. Yang deficiency constipation will also manifest with a stool that has a normal consistency, the constipation arising from a lack of yang movement in the intestines. The stool will take a long time to pass through the intestines, and the person may feel exhausted and sweat after passing the stool. Lang qi deficiency can also manifest with exhaustion and sweating after bowel movements. Again, the person lacks the strength to transport the stool downwards through the intestines. The effort of passing the stool will weaken the person's qi so much that they will feel exhausted and the lung will temporarily lose control of the pores, resulting in spontaneous sweating. So constipation, dry stools, abdominal tension, and pain signifies excess heat. Constipation, compact stools, abdominal tension, cramping pain is excess cold. Small lumpy stools, stools that resemble goat droppings, signify liver qi stagnation. Long loose stools, not hard or dry, indicate spleen qi deficiency. Dried stool, the abdomen does not feel tense or tight, blood deficiency, yin deficiency. Fatigue after defecation, lung qi deficiency. Sluggish stools, qi stagnation, yang deficiency. Constipation in a woman who has just given birth, blood deficiency. Alternating constipation and loose or normal stools, liver qi stagnation. Conditions that are better after defecation, excess conditions. Conditions that are worse after a bowel movement, deficiency conditions. Thank you very much for your attention.